So as the search continues for this magic drug, we're joined by someone very special. Dr. Jalil Parkar is one of Mumbai's leading pulmonologists at Lilavati Hospital, and guess what? He's just recovered from a very serious attack of coronavirus and he's back with us. Good to see you, Dr. Parkar. First of all, hail and hearty. Last time I spoke to you 2 weeks ago, you were in ICU. Yesterday when I spoke to you, you were finally back home. How difficult have the last 2 weeks been for you? You're a doctor who had coronavirus, as many health workers are having. How difficult have the last 2 weeks been?
Well, Rajiv, I think it is a blessing of all the people and their prayers that has worked and I have survived. It was a very difficult situation for me because on the 11th or I think on the 11th of June, I started feeling severe backache and pain in the spine. There was no fever, no cough, no dyspnea, and immediately I thought that this is the beginning of COVID. So I started the Bangladesh regime, which is called as ivermectin, where we take 12 milligram alternate days for 3 days, and then I also took tablet doxycycline 100 milligram twice a day for 5 days. Having completed the course, I realized that I was not getting better. On the contrary, I was getting worse. And on a particular night, I think it was the 13th, I realized that I just have to get up and reach the ICU of Lilavati Hospital, or else I'm going to be a dead man. Now, the authorities of Lilavati Hospital, they were very kind, along with my colleagues, who got an ambulance organized for me. And I really don't know whether I was naked or I was in my shorts when I entered Lilavati. Immediately they did a CT scan and they found that there were lesions in the lung. So I was shifted to the intensive care unit where my oxygen levels were around 92 to 94% on 1 liter of oxygen and on room air 2. Then the very next day, I went in late night, and the very next day I saw that my wife had to be admitted and she was on the next bed next to me. It made me wonder as to what I would reply to my son when he would say that, why didn't you save my mother? So I made it a point and determination that I have to turn around, I have to come back, I have to save my wife, and I have to save my child's mother, and I have to return back to see to it that I treat the patients whom I was unable to treat. Now, during this period, when I started my treatment, there was a colleague of mine, his name is Dr. Desai, and while I was in the ICU, I saw that he was also not keeping that well. So I told him to get hospitalized, but he too, like me, he tried to take some treatment earlier, because we doctors, we always try to treat ourselves. But then he called me one day and he says, Jalil, I've got fever. I said, come to the hospital immediately. So the day I left the hospital, he was hospitalized.